Talk about this epidemic of heroin, prescription drugs, and now fentanyl and other synthetic heroin. It's devastating our communities. My home state of Ohio, unfortunately, is one of those states that's seen the tragedy of this epidemic unfold. The grip of this addiction has affected every single state in this chamber, though. People are talking about it more and more here in this chamber because it's affecting every one of us. Every community, by the way. It knows no zip code. In the rural areas, in the suburban areas, in the inner city, no community is safe from it. Yesterday, I had a coffee, which I do once a week, our Buckeye Coffee, and I had a woman come up to me at the coffee. His name is Sheila. Sheila told me about her son and her daughter-in-law. They had overdosed. They were unconscious. She luckily had Narcan, this miracle drug. It's a name of a brand name of naloxone. She was able to bring them back to life. She then started a group that's all over our state now, which is called Friends of Addicts. They're in 5 different counties. They're focused on the hope of treatment and recovery, but they're also focused on, when Narcan is administered, going to people, intervening with people, getting them into treatment, getting them into longer-term recovery, and helping to save lives. I so appreciate her and so appreciate these other parents like her who around the state today are ensuring that, yes, we save people's lives with Narcan, which is so important, but that we also ensure that we are getting people into the treatment they need so that they can get back to a productive life, back to their families. This chamber passed legislation called the Comprehensive Addiction and Recovery Act, CARA, earlier this summer. That legislation is now being implemented by the administration. I hope they accelerate that implementation. They must, because the epidemic is so urgent. But unfortunately, that legislation, which was written over the last 3.5 years, doesn't address one specific issue that I think must be addressed now in the context of what's happening in my state of Ohio and around the country. Because it's not just prescription drugs and not just heroin. Increasingly, it's a synthetic heroin called fentanyl or carfentanil, sometimes U4. This is poison, and it's getting into our communities. It's much more powerful than heroin. Just having a few flakes of it ingested can kill a human being. What we've seen in Ohio over the last couple of months is huge spikes in overdoses. In my own hometown of Cincinnati, we had 174 overdoses in a space of 6 days. Miraculously, most people were saved by Narcan, but sometimes having to be administered 4 or 5 or 6 times. The authorities knew it wasn't just heroin, and sure enough, we were able to get a sample to them of carfentanil, thinking that might be the problem. They tested it, and sure enough, many of these overdoses were caused by this synthetic heroin, which is 100 times stronger than heroin in some cases. By the way, it's a large animal tranquilizer used for elephants in zoos. And yet, these traffickers, these pushers are using this drug, not just causing overdose, but overdose deaths. So we need new legislation. And in this chamber, last week, we introduced legislation to be able to stop this fentanyl and carfentanil and U4 and these other synthetic drugs from coming into our communities. What we are told by the authorities is that the drugs come in by way of the mail system, and primarily from China, sometimes from India. So there are chemists in sophisticated laboratories in these countries sending this poison into our community. All we are asking in our legislation is to say, let's ensure that packages coming from those countries have the information provided so we know where they're coming from, where they're going to, what the contents are. Unbelievably, that's not required now. It is required of FedEx, UPS, other private carriers, but not of our mail system, including the U.S. mail system. Talking to law enforcement, including Customs and Border Protection, the DEA folks, people who are day-to-day in the trenches dealing with this issue, they all agree this legislation makes sense to try to stop some of this poison from coming into our communities. So, Mr. President, I've been on this floor every single week since our legislation came up here back on March 10th. I've been talking about the importance of getting the legislation passed. That's now happened. I've been talking about the importance of implementing it quickly. That's now happened. The Comprehensive Addiction Recovery Act was supported by an amazing 92-2 vote in this chamber because every state is affected. Now I believe we need to do even more with regard to this specific issue of these synthetic drugs coming into our country through the mail system. And I ask my colleagues who support it, with 92 of us supporting that legislation, please look at this legislation, support this, get it to the floor, get it to a vote, and let's begin saving more lives with this new wave of synthetic heroin that's coming into our communities. Mr. President, I yield back my time.